In Maharashtra's Melghat region of Amravati district, 65 children under the age of 6 months have died due to malnutrition since June this year. And after all these years of reports, promises and so-called development plans, the Bombay High Court has finally slammed the Maharashtra government for what it called an insensitive and grossly negligent approach. And honestly, how long will this continue? These are tribal families, Adivasi communities, the same communities political leaders call their vote bank, the same communities they visit during election with tall promises. But when it comes to real development, real healthcare, real protection, suddenly the urgency disappears. Melghat has been crying for help for almost 2 decades. Courts have passed orders since 2006. Committees have been formed again and again. Documents and presentations show everything is under progress. But on ground, children are dying. And every time the number rises, the responsibilities gets pushed around like it's nobody's job. And that is exactly why the Bombay High Court said this is not about numbers. This is about humanity, dignity and the right to live. In 2025, in one of India's richest states, a newborn still dies because there is no doctor, no nutrition, no transport, no help. If this is not failure, then what is? Hi, I'm Khatija and you're watching Lokmat Times. In this video, I'll break down what exactly is happening in Melghat, why the High Court has taken such a strict stand, why these deaths continue every single year, and what this says about our system. But before we get started, don't forget to subscribe and press the bell icon for all the latest updates. Let's begin with the core fact. Between June and November 2025, 65 infants in Melghat died due to malnutrition. These are children younger than 6 months. And this is not a sudden problem. This is a repeated tragedy that happens every year. The Bombay High Court, led by Justice Revati Mohite Dere and Justice Sandesh Patil, was hearing a group of PILs about the crisis. And during the hearing, the judges said one clear line: this is deeply shameful for the state. Now, why did they say this? Because this isn't a new issue. The government has been receiving court orders since 2006. Yes, almost 20 years. But nothing has changed in real life. On paper, everything looks perfect. Nutrition programs, health missions, awareness drives. But the moment you go to Melghat, the reality hits hard. There are no doctors, no proper roads, no transport, no nutrition supply, and no accountability. The High Court literally said the government's approach shows how unserious they are about saving lives. And honestly, when a child dies, it is not a figure, it is not a statistic, it is a life lost. A family destroyed, a mother carrying her baby for 9 months only to lose them because the system didn't care enough. The court questioned why even after so many years and repeated warnings, malnutrition deaths in Melghat continue year after year. The situation is so bad that the High Court has now summoned 4 top officials, the Principal Secretaries of Public Health, Tribal Development, Women and Child Welfare and the Finance Department. They have been ordered to appear in person on November 24. And not only that, they must submit detailed reports on what they have done so far. The biggest problem highlighted is the massive shortage of medical staff in Melghat's remote villages. Doctors don't want to go there, the conditions are tough, the pay is low and the workload is huge. The court suggested that the government offer higher salaries or incentives to medical professionals willing to serve in such hardship zones. Because at the end of the day, if there are no doctors, no nutrition officers, no support staff, how will anything improve? Melghat is one of the most backward areas in eastern Maharashtra. It has struggled with chronic malnutrition, poor healthcare and high infant and maternal death rates for years. The government talks about it. Every year committees visit, we hear the same promises, but the deaths never stop. And this time, the High Court also said something every citizen should hear. Accountability must be fixed. Because without accountability, without someone directly answerable, the cycle will continue. More reports, more files, more meetings and more children dying. This crisis is not a sudden disaster. It is a slow, painful story of over 20 years of neglect. And the most heartbreaking part, that these children died from something preventable, something that can be stopped with basic support, proper nutrition, early medical help, clean water and trained health workers. The High Court has now pushed the government to act, but the question remains, will this time be any different? Or will Melghat's children continue to become just another number in next year's report? Because at the end of the day, this is not about data, this is about life, about dignity, about children who deserved a chance but never got one. Now the next hearing is on November 24 and all eyes are on whether the government will finally take real action. So what are your thoughts? Do you think this time something will truly change? Let us know your thought in the comments.